Root canals have a bad reputation, and some people even call them dangerous. But what if I told you that fear might be based off a 100-year-old myth? I'm a dentist, and I'll walk you through the surprising history, the real science, and what you actually need to know, because it could save you from losing a perfectly good tooth. So, where did all this fear around root canals begin? It's not a modern phenomenon. It goes back to more than a century, a time where dental infections were really life-threatening. And around the 1920s, there was a dentist named Weston Price. He believed that root canal teeth or root treated teeth could leak harmful bacteria into the bloodstream, and that can lead to chronic illnesses across the body. Things like arthritis, kidney disease, heart disease, you name it. And Price tried to show this by taking teeth that had root canal treatments, implanting them into the skin of rabbits, and then claiming that these rabbits became sick and died as a result of the experiment. And these experiments were shocking, and the idea became known as the focal infection theory, essentially the belief that any hidden infection in the mouth could silently poison the rest of your body. But back then, there was no reliable antibiotics, there was no advanced disinfection, and there was no modern equipment. And truthfully, dental infections were scary. So at the time, the theory felt believable. And in fact, the theory was so powerful it led to what we now call extraction mania. So imagine going to the dentist for a small cavity and they tell you, let's pull out every tooth in your mouth just in case. And that actually happened. Medical doctors used to refer patients to have all their teeth pulled to supposedly treat everything from depression to arthritis. But here's the turning point. So, as antibiotics were developed and dental technology was advanced through the 1930s and 1940s, the medical community began to challenge Price's research. New, better designed studies showed that his experiments were flawed. So, rabbits are not humans, and the conditions used in his studies are nothing like modern root canal procedures. And slowly, the medical and dental communities moved away from this theory. But the fear never really went away fully, and it's been passed along even through stories, social media, and anecdotal claims. And if you hear somebody online talking about repeating these century old claims, remember they're talking about a time before antibiotics, before rubber dams, before sterile procedures, before modern endodontics, and in a completely different world.